So before we give any medication to anybody, we got to know that we have the right patient, the right medication, the right dose, right route, the right time, and we get the right effect at the end of it. And basically for you guys, these patients, if they are going to get medications, they're supposed to have that folder that's maintained at your front desk, right? Mm-hmm. So you know exactly who needs medications, what kind of medications, and it's should have been done by the provider. And they're supposed to have current medications there, so just make sure you guys are tracking those. And if they are coming due, just let the parents know, hey, by the way, the medications you have here on hand is within 3 months coming due. Please talk to your pediatrician so you can get a refill, because it's all weight-based for kids. So if they've gained quite a bit of weight, then the provider has to redo their medications, and they need to get new form, new dose, and everything. But obviously, don't discard old medications because they are coming due or they are due until they are replaced with a new one. Because sometimes we here at Yokota don't necessarily get the meds right away from the docs, or not from the docs, but from logistics, because apparently we're the last leg for supply, so we get what we get. All right, for the EpiPen, it's really easy to use. Your kids having anaphylaxis, from allergic reaction from whatever they were exposed to. You go to their folder, they should have an EpiPen there. Make sure that it has their name on it, all the stuff. Make sure it's not expired, and then like the backside, if you don't know how to use an EpiPen, or from this training you forgot how to do an EpiPen, it's step by step. It's a 3-step process, just like in here. First, you're gonna remove the blue cap. It punctures through any clothing, so you just leg 1, 2, 3, and release, and then you're gonna observe the child for relief, and make note of how the child is reacting to the medication, if there was immediate relief from the medication. And also, obviously, somebody would have been calling 911, the UC would have been notified, so they would have been sending a person here, and then you'd let them know what happened, what you gave the child, and then what time, so they can document all of that, so they know if they need to get a second one, they know, it's within that right window or whatever. And
what are the signs of anaphylaxis?
Hard of breathing.
There you go.
Breathing.
Like swollen lips.
Swollen lips, yes.
Yep.
So it's usually anaphylaxis is defined as 2 symptoms. You can have like nausea, like vomiting, rash, shortness of breath. What else? Yeah, lips are swelling, tongue swelling, stuff like that. So they're not acting right, and then they have a known allergy. For sure, using EpiPen right away.
The most important one is obviously the obstruction. If they're obstructed in their throat, their airways obstructed, then that's the worst case scenario. So please get them the meds right away. And then to dispose of this, you just give it to the responder so they can dispose of it properly. But yeah, pretty easy to use. You said you guys had a trainer over here now, right?
Yeah.
Okay.
So just be aware. Yeah, there's a big needle in here.
Yeah.
And so make sure you don't put your finger here accidentally, because people get poked through it. So, but yeah, definitely get to practice.
Only hold it like right here.
Hold it right there. And
Pull, hold, and don't ever touch the tip side.
And then make sure the child's thigh. Don't put it right in the middle of the thigh, because there's a big nerve in there. Push you at the thigh, the medius part on the side, through there. So.
Yep. There you go. You just kind of play with it, pass it around.